Everybody keep eating your lunch. I hope you had a really good morning. I hope everybody got some things, accepted the challenge that I offered you this morning, and we have more to see as the afternoon goes on. Today it's my privilege to introduce our keynote speaker, Attorney General Tim Griffin. Tim, a fifth generation Arkansan, grew up in Magnolia, Arkansas. He graduated from Magnolia High, attended Hendrix College in Conway, Tulane Law School in New Orleans, and attended graduate school at Oxford University. You know, funny story, this is how small Arkansas is. I say this everywhere I go. I just found out that my next door neighbor went to high school with Tim Griffin, and I live in Conway, and that stuff happens all the time in Arkansas. Tatum, Don Tatum, yeah, he had some stories. So,
I got stories about him.
But that's what I love about Arkansas, though. That's exactly my favorite part of Arkansas. It was just this time last year, Tim was elected Attorney General. In 2014, he was elected as our Lieutenant Governor for the state of Arkansas. In 2018, he was elected to a second term. From 2011 through 2015, Tim served as the 24th representative of Arkansas' 2nd Congressional District. And during his time with the 113th Congress, he was a member of the House Committee on Ways and Means. He also served as a deputy whip. In his service in the 112th Congress, he served as a member of the House Armed Services Committee, the House Committee on Foreign Affairs, the House Committee on Ethics, and the House Committee on the Judiciary. During President George W. Bush's administration, Tim served as the assistant to the president and deputy director of political affairs at the White House. During 2006 and 2007, he also served as the United States Attorney for the Eastern District of Arkansas. Tim has served as an officer in the U.S. Army Reserve, Judge Advocate General's Corps for 26 years, and he currently holds the rank of colonel. I think it's important to note in 2005, Tim was mobilized to active duty as an Army prosecutor and served with the 101st Airborne Division in Mosul, Iraq, for which he was awarded a Combat Action Badge. Today, he continues to still serve as staff judge advocate for the 81st Readiness Division at Fort Jackson. And it's as if he had not done enough in 2018, then Lieutenant Governor Griffin, in his capacity as a lieutenant colonel in the United States Army Reserve, received a master's degree in strategic studies as a distinguished graduate from the United States Army War College. I've had the honor and privilege to serve with Tim in my previous capacity when bringing forth federal prosecutions when he served as the United States Attorney. In February, when the governor gave me the opportunity and announced my new current role, I was privileged to be with Tim in the room at that moment as well. So without further ado, our Attorney General, Tim Griffin.
That'll make you feel old, right there. Thank you all so much for being here. We had over 1,300 people register, and I haven't counted how many are actually here, but it's a lot. It's a whole lot. That's a lot of salads. And you can probably have two if you want it. I see a couple I'm going to take when this speech is over. Anyway, I want to thank the staff at the AG's office who've worked on this. Rachel is their fearless leader, and they've just done a great job. We're always coming up with a new summit to have. We did a human trafficking summit. Now we got this summit. We're doing a cybersecurity summit. We got a lot of summits, and they don't just throw themselves together. They take a lot of work. So I want to thank all the staff who've worked on this. Josh, Oneshri, Grace, Rachel, anybody who I didn't thank. I would walk around with this thing, but I'm sure somebody's camera would be mad. But I want to thank them. Also want to thank our partners specifically on the issue of addressing opioids. Kirk Lane, who's with the opioid partnership, he's coordinating all the efforts for the municipal league and the Association of Counties, and of course, Tom and all that he's doing. He's been a huge help, and we coordinate with him as well. So it really is a team effort. I appreciate y'all showing so much interest in this issue. Unfortunately, overdoses, whether it be prescription drugs, illicit, illegal drugs, they're not going away. It's a persistent problem. And so this is not a one and done. We got to keep doing this as we are. We've changed it a little bit this year. But generally speaking, we're still doing what you've come to expect, which is allowing people who are working to solve this problem to network and interact, get to know each other, exchange phone numbers. If people can't reach you, they can't work with you. Exchange your contact information. We're also providing the training and the information you need to be more effective in combating drug overdose. So we'll continue to do that, but we want to look for ways to improve year to year, and we welcome your feedback on that. What I would like to do is just tell you how I'm approaching. I know a lot of you here, not all of you, but a lot of you have asked for money, opioid money in particular, opioid settlement money in particular. And I want to talk about the opioid settlement, the money, and my approach to granting the money that is coming in. As you may know, there's a tranche or a section, an amount that went to the counties and the cities, or is going to the counties and the cities through the partnership. And then there's an equal amount that is coming to my office. And what I'm doing is I'm taking requests. I will tell you I've gotten about 40 times, in terms of the amount of requests, money requested, 40 or 50 times the request of the money that we actually have to give out. I think we've had, I don't know, is it 150 million or 250 million in request for 20 million or something like that? So there are a lot of people seeking the money, and so it's a process. I've put together a process internally, but I want to tell you, I won't get in the weeds. If you want to request money, basically send me a letter laying out with as much detail as possible what you want to do with it, and we'll review that. It's extremely competitive, as I know it is with the cities and counties. There are a lot of people wanting money. And this is money that is going to come in the coming years. There's not this big pot of money just sitting there right now. But all of those details aside, I want to tell you my approach, which is not right or wrong compared to other approaches, but it's my approach, and some of it is because I know that others, the cities and counties, as you would assume, are focused to some degree on the cities and counties. That's what you would expect. So when I came into office, I said, okay, how do I want to approach this money in giving it out? To some degree, yes. There's going to be some overlap. Maybe someone asked for money and didn't get it from the partnership, and we decide that to give money, or vice versa. That's fine. That's totally fine. And some of it will certainly benefit counties and cities. That's fine too. But I asked myself, should I do something different as a statewide holder, office holder? Should I have a different perspective? Not a higher standard, not a lower standard. Should I have a different perspective? And I think where I landed is the following. We're going to look at everything individually, and a good idea is a good idea is a good idea. And if I really like the idea and I think it's going to help people, then I'm going to commit opioid settlement money to it. And those those projects that receive money from us may in many ways look very similar, if not identical, to the type of projects that the Opioid Partnership and Kirk are funding. In fact, one of the checks that I'm going to announce today is exactly the same sort of thing that they're doing. Different recipients, which matters, but the same sort of thing. And we'll be doing a lot of that. And a lot of that funding that we'll be issuing, granting, will be what I call ephemeral, meaning it won't last forever. It will do some good, but in 10 years, it'll be gone. For example, if you give someone $500,000 to buy a bunch of Narcan to distribute, in 10 years, it's gone. They expire. I don't know how many years they expire, 4, 3? So in 3 years, it's gone. That's a perfect example of ephemeral. Here's another example of ephemeral. Somebody says, hey, we need operating expenses to help us with our clinic for 2024. We need X amount. We give you that amount. 10 years from now, guess what? It's gone. It's not coming back. It did some good, but it's gone. We're going to do some of that. By definition, we're going to do some of that. But there's one area that's different that I really wanted to do, and I'm seeking out opportunities to do this. It's much more expensive, but that is investing in infrastructure that will be functioning, that will require other funds to operate, but will be around 10, 20, 50 years when we're all gone. Not that you'll all be gone in 50. I'm sure I will be. But way down the road, I'm looking for investments that will continue to be working on this problem. Building brick and mortar, building an ecosystem, bringing in the best experts, whatever. Building a long-term infrastructure. That's very different than a $100,000 check here or a $800,000 check here or whatever. It's very different, and I get that. But as a state elected official, I feel like there's a certain obligation, which I made up. Nobody said there is, but I feel this way. I feel like I need to do something that's going to be lasting for the whole state, not just a piece of it. So that's a big part of my focus. Now, the downside to that is you can't do 1,000 of those. You can only do a handful. By definition, that's not $1,000, $100,000 checks or whatever. That may be just a handful of checks in really, really big amounts to really, really significant enterprises. And I'm looking at all that. Why am I telling you this? Because you need to know. This is important, particularly if you've asked for money. But this is important because you deserve to know my thought process and how I'm approaching this. And so we're going to have some announcements in the coming days, some of which will be the ephemeral kind. In fact, I'm going to mention a couple here in a minute. And some are going to be related to long-term, massive investment that I think will be a game changer for the state. And so when you see that, I think when you see the announcements, and we don't announce a lot of the ones we give out, we just cut the check. But when you see announcements or you hear of money going out, you'll be able to stick them in one of two categories, those two categories I mentioned. And I think in that way, we are able to cover all of what I think we should be covering, which is prevention, care, prevention, keeping you from getting to a problem, care, helping you deal with the problem, and by definition, making sure you prevent it happening again. And how about this one? Research. There is a paucity, a lack of research as it relates to some of the demographics, ages, individuals that are impacted by opioids. Some of them we need more research to better know how to treat and address and deal with the health outcomes. So research is important too. That's a harder one because you can't pop a research entity up in your garage. You can't just start a nonprofit and say, give me some money for research. It requires scientists, it requires infrastructure. It's a much more expensive enterprise. So anyway, that's the lay of the land with that money. Now, on the issue of Narcan, I want to bring, first of all, let me just say Kurt and the Opioid Partnership, the cities and counties are doing an awesome job. And one of the things that they did is they said, and if I say something wrong, feel free to come up and correct me. They said we're going to fund Narcan for law enforcement that don't have the money to otherwise purchase it, correct? But that did not include some of the state law enforcement. You know, we have local, we have city, we have county, we have state. And they suggested, if I remember correctly, this might be a good area where y'all can play a role with the state law enforcement. And I said, great idea, Kirk, as I have that on recording. Just hit the button. Great idea, Kirk. No, I'm not asking for money, Kirk. And so that brought us to more collaboration with Tom, who, as the state drug director, a job that Kirk used to have, he said, I can survey the state and I can figure out what our need is, okay? And that's exactly what he did. Now, the check has already been sent, so I'm not going to ask Tom to come up and get the check because it's gone. But I will tell you that we purchased for state law enforcement 5,680 Narcan kits at a cost of $232,880, and those are being distributed. That process has begun, and they will be distributed to state law enforcement, state police, game and fish, highway police, you name it. There's a lot of them out there that need those. So that's your money, that's public money that the state got as a result. And as you probably know, the opioid settlement is very restrictive on what we can spend money on and what we can't. It's got to be opioid abatement. And this is 100% that. So we were happy to be able to do that. And I want to thank Tom. I want to thank Kurt for suggesting it and Tom for organizing it. And let me say something else, just so you know. If your project is partially opioid related, we can't fund the other partial part. So if you say, well, I want money for a clinic, and I want $1 million, don't we all? I want $1 million for a clinic. And I say, well, how much of your work is opioids? You go, I don't know. So first thing I'm going to say is you need to find out. You need to either survey the people that came through. You need to have some way of knowing what percentage of your population struggles with opioids. Because I can't give you a penny until I know that. So if you come back to me and you say 73% of the people that we see have an opioid problem, then I can say, okay, you asked for $1 million, I can give you $730,000 as the max I can give you. Because I have to fund opioid abatement. I can't fund alcohol abatement or whatever. Cocaine, meth, those are all great causes, but I can't fund that with this money, okay? It's important to tell you that. And then you can't go, well, let me raise the amount I need so I get to $1 million. It didn't work that way either. So anyway, there are a lot of rules that we're bound by, and we're trying to do our very best with lawyers like Colin and my lawyers and others to make sure that we do our very best to follow that so that we don't get in trouble with the court who signed off on these settlements, and where we're demonstrating good faith. Now, I have another announcement that I'm excited about, and I want Dr. Martin to come up here. Dr. Kristen Martin of Russellville. She's got a fan club, apparently. Nobody was yelping for me. So we go through a lot of applications. And Kristen, Dr. Martin, came to me and said, and you have more degrees, MD, DO, PH, whatever. She's got a whole list of them, MA, BA, BS, you name it. That was a joke. Anyway, she has got great experience in dealing with individuals who are struggling with addiction. And one of the issues that we've been struggling with is making sure unserved or underserved communities in the state get the help they need quickly. And within our budget. We can't afford to build brick and mortar in every county in the state and equip them with employees. There's not enough money if we combined with Kirk and his crew. Not enough money. Not enough money. So we've got, also in some counties, there's far fewer people living there than other counties. So we've got to be efficient, and we've got to spend money wisely. You're not going to spend $1 million on a clinic in a county, with a few thousand, and then $1 million in a clinic in a county with 100,000. That doesn't make any sense. So she came in with a proposal, and former U.S. Attorney Bud Cummins, who's here, and they said, look, we can get a fitted out, I used to be an RV guy, I don't do it much anymore. It's hard to sleep when my kids are running around in there. But I'm familiar with RVs, and she said, look, we can get a clinically fitted out medical RV with everything we need to provide the care that we need, and we can put it in any town in Arkansas for a week or 3 days or 2 weeks or whatever, and we can address this problem. And I said, well, and the goal is to have them in regions that are underserved. And I said, well, I tell you what, I'm not going to bite on the whole deal, but let's do a pilot. I'll help you with one. You get it in those counties, you show me it works, and then we'll talk about the rest. Because that's a lot more efficient than waiting for 10 years to build some stuff in counties where you may not even be able to man them. She's going to be manning this with other experts, or woman in it, whatever the word is. In any event, I'm proud to tell you that we're funding this, and it's got a great name. I had to put my glasses on to read this acronym. They call it ARMOR, the Arkansas Mobile Opioid Recovery, and it is going to be a bad RV. Coming to an RV park near you. Don't try to buy it, because you can't afford this one. And I don't know how many it sleeps. But in any event, so we are proud to provide a check that will purchase this and get it going in neighborhoods and communities really fast. $777,000 to the Arkansas Mobile Opioid Recovery. Let's cheer. Let's all pull for her to be successful. Because if this model works, it's a relatively inexpensive way that we can get help to all four corners of the state in the underserved or even unserved areas of the state. So thank you, Dr. Martin. Do you want to say a couple things? Or more?
Sure. Thank you so much, Attorney General.
Close.
It might be a little dangerous to get me a microphone. Anybody that knows me knows I love to talk about addiction and what we can do to find solutions. I am so grateful and honored to be chosen as one of the recipients in our team, and so many that have helped us get here and encouraged us. We've been wanting to do this for a couple of years, and a lot of you know me as the little doctor that drives up and down the highway. And being able to take care of people out of the back of an SUV wasn't very glamorous sometimes. But there's peers here from all over the state, right? If you're a peer recovery support specialist, raise your hand, right? If you're law enforcement, as an ER doctor, if you're law enforcement, many of you I know because I've worked your rural ERs, and we have seen the tragedies that have happened whenever people cannot get access to care. And so I appreciate so much all of you that have worked with us, and anybody who needs help, we will give you our number. You call us. We are really serious about reaching those who have not been reached before and helping to connect the resources. We are not in competition with each other. We are all in this together, and we are here to fight that fight, and I appreciate your support of our project. Thank you.
Thank you, Doctor. So, just to sum up, I see the U.S. Attorney over here, Mr. Ross. Thank you for being here. We are honored by your presence. He's a great partner. There's a lot of bad folks out there doing bad things, putting dangerous, if not deadly, drugs on our streets. Some of the ingredients are coming from China, manufactured below the border in Mexico, and he's putting a lot of those people away for a long, long time. He's a great partner on the law enforcement side. In any event, I really appreciate y'all coming. I appreciate your continued support of each other. Please enjoy the rest of the day and let us know if we can help in any way. God bless you. Thank you so much. right here. Come on, y'all. Come on. Come on, guys. Come on, y'all. Come on, y'all.
You know, it's like,
All of us at once?
yes.
Are you with them?
Yes.
Okay, good.
Let's do it.
makes the best cake.
Okay, all right, that's good to know. That's just what I need to. Hey.
Oh, hold on. Hold on.
What's my gun?
Oh,
It's all right.
I'm so sorry.
No, no worries.
I'm sorry. It's nice to meet you.
Anyway, see ya. Thank y'all. All right.
Cool. I just want to make sure. Thanks. No. We'll put it up. We'll put it up there.
What? Nate, do you want some photos? No, I was just saying bring Lucy. Oh, is Lucy there? Yeah, sure, I'll bring Lucy.
What do you need right here?
I'm just grabbing the mic. It's off.
That's gonna all come back up here. It's gonna come back to how it looked this morning.